How are you?
Good, how are you?
Fine. We just went to the vet.
Yes.
We found something new.
Yes. Umbilical hernias.
Yeah.
Can you explain to me the difference?
Well, I can say what the vet said. You know, I've never been doing this for almost 50 years, and everybody sometimes talk about the umbilical hernias. The first thing is that they're not really hereditary. It's more of the inguinal hernia that are hereditary, and that the size of the hernia that you see outside has nothing to do with the size of the hole inside, where if the hole inside in their intestines, like, you know, they have the hernia here,
Yes.
and you put your finger in there, if you can't fit your finger, then yes, it would need surgery. He said even more than a finger. But like some of the puppies that we have always been very hysterical about, oh my God, they got hernias.
Right.
He said, no. Usually hernias that are very, very little, where I can't even fit my little fingers, I won't never worry about that. There's no way that the intestines can come out. And I asked her, you know, why they have such a big thing? He says, that's pure fat, that's grease. And if they want to do surgery, it would be only a cosmetical surgery, but it's nothing that is going to hurt the puppy, or it's going to kill the puppy, or it's going to create a mortal situation. So I'm going to add to this conversation the explanation that Dr. Williams did to us. And I like Dr. Williams. She's a vet and she's a breeder for many, many years. So we can talk about this, you know. So many people sometimes say, oh, the umbilical hernia, but there's no harm to it if the hole inside the area where it covers the intestines, which is not the size of the hernia, it's what's inside. If it's less than, I don't remember,
6 millimeters?
something like that. It was some, yes, but I have it in the video. She showed it in the ruler, and everything is there. So I like to share this with our Southern
All right.
families.
So real quick though, so when they go, say when they're 2 years old and they're like, okay, we're going to get them spayed or neutered. They can go in and go ahead and fix it then if it bothers the client.
The client.
Okay.
But really, there's no necessity.
Okay.
Really. But if they want to do it as a cosmetic thing, yes, they can. You know, that's no problem. They don't have to go through anesthesia before that.
Right.
To wait for that. So we'll show now the video.
Thank you.
Here we are with the vet. This little puppy has a hernia, okay, and she's explaining to us what the problems with the hernia is. So you say that even though it looks big, that's fat.
Yes, all of this is fat coming through.
So it's not the intestines that are coming
Nope,
through there.
that's just some fat.
Okay.
And then if you push into it, baby, if you push, wait, sit down, baby. If you push into it, now everything is all flat now because I've pushed it back in.
Oh, okay.
And then I'm actually feeling the size of the hole.
Okay.
And it's probably, I go in millimeters when I
When you push.
when I measure. And that's probably about a 2 to 3 millimeter hole.
Okay.
Because it's about this much of my fingernail that I can actually stick in there. So that's at the point where it's not harmful for him to keep it because intestines and organs cannot fall through that hole.
Okay. So the only thing, I mean, they could, when they neuter him, when it's time to neuter him at 2 years, like our contract says, they could take that out if they want to.
Yes.
But it's not something that has to be done now.
Correct.
There's no immortal thing right now.
Correct. And it might be that by the time neutering happens, is that the body wall closed up around it and left that ball of fat trapped there.
Okay.
And then you just, cut the fat out, do a little liposuction, cut a little bit of skin, and put it back up.
Okay.
But yeah, that's everybody's preference. Everybody, decides what they want for their
But
body.
it's not nothing for mortal thing that can, no.
He will not pass away from this.
Okay, thank you.
Yeah.
I'm saying that the hernia for the black and red puppy is about 6 millimeters
Okay.
in width, the actual hole
Okay.
into the abdomen.
Okay.
But it's still not likely that his intestines or any organs can put through there and cause a problem.
Perfect. Okay.